I always recommend patients see a trained plastic surgeon for any body contouring procedure such as liposuction. Most plastic surgeons who perform liposuction are doing a lot of it in their practice. So once you're doing a lot of something, it becomes a very safe procedure. I don't recommend going to somebody who's not a trained plastic surgeon because liposuction is a surgical procedure that definitely comes along with risks and potential complications. But in my practice, yes, it is a very safe procedure. Some of the concerns with liposuction are infection, bleeding, but again, those are pretty rare as long as you go to a trained plastic surgeon who performs these procedures regularly. Prior to performing liposuction, what we do is we actually inject a fluid in the areas that we're going to perform liposuction, and that fluid contains two things. One is lidocaine, which helps with pain during surgery. The other is epinephrine, and epinephrine helps clamp down on the blood vessels, so there's very minimal blood loss prior to liposuction. After we have that fluid in, what we do is we start to perform liposuction, and what that usually entails is there's a cannula and it's attached to a suction system. So then once it's entered in specific areas that we're trying to remove fat, it suctions out the fat cells. And it's not just kind of randomly sucking out fat in areas, but it's really important to go to a plastic surgeon because there's different layers of the fat under the skin, and you really want to target those specific layers to get the best body contouring result that you can get. One of the most common questions that I'll get from patients regarding liposuction surgery is how much fat can be removed. Some of the other concerns that patients might not be aware of is not necessarily from a safety perspective, but really from an aesthetic result. If you perform liposuction kind of in the wrong layers or just under the skin, or somebody who's not well trained in liposuction, it can really create some skin irregularities and some scarring underneath that's then very difficult to fix, if even possible at all. So that's why I always recommend go to a trained plastic surgeon who knows the correct technique of where and how to perform liposuction.